Hi, my name is Karen Carter, and I am a financial advocate with Carol's Wish, which is under the umbrella of COCA. I'd like to just give a brief introduction to Carol's Wish. I think it's probably best described in our mission statement, and that is that our goal is to no one should have substandard medical care due to financial reasons. So with that explanation, I'll kind of head into Medicare open enrollment and what it takes to kind of walk through the website. I am actually, my presentation is part 2 of 2. The first part is given by Rachel Dower, where she kind of walks through outlines for some of the basic information, guidelines, and terms. And now I will kind of go through the Medicare website for you. The website that you need to go on is medicare.gov. And we're going to get on there right now. So this is what the open page looks like at medicare.gov. There is a lot of drop downs and so forth here that you can kind of explore at your own leisure to gather some further information about your particular circumstances. But for our demonstration today, we're going to walk through the health plans and coverage that are available for 2020. So we'll start with this little link here, which indicates Define 2020 Health and Drug Plans. We're going to not create an account today. We're just going to log in as a guest today, and you'll kind of see the screen where it begins. We're going to, there are again other options here. You can learn more about the Medicare options, Medicare Advantage plan, the drug plan only, drug plan with a Medigap, or the supplemental policy that Rachel talked about in her slides, or the Medigap policy only. For our purposes today, we're going to walk through the Medicare Advantage plan, and you can put in your zip code here. Let's just put a zip code in for Denver. That pops up that it is in Denver, Colorado. Then it asks you the question whether you are getting assistance with any of these other programs, whether it's Medicaid, SSI, Social Security Income, Medicare Savings Plan, Extra Help, and even if you're not sure. But we're going to put down we don't get any help from any of these programs for our purposes today. And do you want to see your drug costs when you compare the plans? Yes, we do. So that's going to ask you the next screen where you get your pharmaceuticals from, whether it's a retail pharmacy, mail order, or both. Again, for today, we're going to do the retail and click on next. So we're going to add the drugs that we take here. You can also browse through the alphabet. Whether we'll start with A, we'll just kind of put in any drug here. So we're going to add that drug. Then they're going to ask you the dosage of the drug. Put that one there. Let's say we take that 20 times every month, and then we're going to add that to our list. So now you can see that that particular drug is added onto the list. Then we're going to add another one. Let's go back and add another drug here. We're going to add a drug. We're going to go to the browse. Let's go to a drug that starts with a G this time. We'll put this one down here. We'll add that one. Then again, we're going to select the dosage. Package this way. We're going to say we need that once every month, and we're going to add that to the list. So now you see you've got 2 different drugs there, and then we're done adding the drugs now. We'll go to the next screen. It's going to ask you which pharmacy you would like to pick your drugs up at, and they're going to give you the closest one to that 80205 zip code that we put in earlier. So let's just put this one here, and we'll also pick the Safeway. So we're done with that. Now it's going to pop up the different type of plans that are available. And they're going to be sorted by lowest premium per month, but you can also sort by lowest yearly drug deductible, lowest health plan deductible, and so forth. But we're going to stay with the lowest monthly premium. So we've got 0 on this Kaiser plan here. You can kind of walk through and see the deductible is 0, the drug deductible is $225, and then it lists your max out-of-pocket at $4,400. Also can see the plan details here of that particular one if you want to do that. As you scroll through the list here, you can at this point view if your provider is in this network. And that's important to do just to make sure if you're going to stay with that physician, you want to stay with that physician, that he is included on this plan. I'm not going to go into that today because that's going to entail, they'll kind of get you into the carrier site and you can walk through that, but we don't need to do that today. So let's go back to our search results. Pops it up. It also it allows you to enroll from the screen as well. You can, on the far right-hand side, if you want to compare, you also rate these policies as well. You can see the rating. This one gets a 4.5 star, excuse me, out of the 5 star. So let's just put a little check mark by that one, and then we'll put a check mark by another one down here, and then you can go down here and compare those particular two that you chose. It's going to pop up at this screen and give you a little more detail with the drug premium amount, the healthcare premium amount, the deductible, and so forth, and exactly what's covered, and some more details down here. So that walks you through a little bit of the Medicare site. You do have to be a certified broker in order to sign you up. You can sign up on your own, but if you want somebody to assist you and walk through this with you, Rachel and I can walk through this with you, but if you would like a certified broker, we do have a name that's also included in Rachel's slides that she gave in part 1 of 2 of this. So real quick, I'm going to put up on the screen our contact information again. And again, that's Carol's Wish. You see Rachel's name on the left-hand side and my name on the right. We have my phone number and Rachel's phone number. We're certainly happy to either walk you through this, answer what questions that we can, and also provide you with the name of a certified broker that's we've got some good feedback on that can assist if you don't have a broker yourself. Thank you for joining me today, and if you have any questions, please feel free to give us a call. Bye-bye.